Driefcase was the first company that National Health Authority approved as a personal health record app, which is integrated with them. And today we have Sohit Kapoor, who, while working with the corporate world, saw PHR, which is personal health record, as a challenge, which was also an opportunity for solving. And he co-founded Briefcase with his friend uh, Harsh Parekh. So welcome, Sohit, to Business World Healthcare. Uh, and my first question to you is, tell us a little bit about the story behind founding Briefcase and what inspired you to create this platform.
Sure. Thank you for having me, Harbinder. It's always a pleasure to talk to you. Talking about Briefcase, as you rightly mentioned, Harsh and I were together at Bank of America Merrill Lynch, in the India investment banking team. And over a period of couple of years, 2-3 incidents happened which made this problem stand out for us. So Harsh had an older relative who was visiting from the US, and about post dinner, 9 or 10 in the night, he suddenly complained of chest pain. So here's a 70, 75-year-old gentleman complaining of chest pain, and it's not good news in normal circumstances. So he was rushed to the ER. They conducted an ECG, which is a standard procedure. And the doctor came and said, I can see some abnormalities in the ECG, but it could be normal for this gentleman. So if you could show me the last ECG, it will make things easier for me to diagnose. This gentleman was traveling from US. There was no one at home in US, and his documents were there. He was not carrying them. So out of precaution, he was admitted to the ICU for 2 days. And it was ultimately diagnosed that this was a case of, just gastric trouble, acidity. We keep joking that it was one of the most expensive cases of acidity. But, even if you leave aside the expenses part of it, the real issue is that here's a 70, 75-year-old gentleman isolated in an ICU, away from family, suspected of heart trouble. The amount of stress that everyone, the patient and the family, had to go through because this document was not available. And it's a very small piece of document. As you know, ECG can be carried practically in your pocket, but no one does that, right? So that was one instance that came up, and Harsh and I keep discussing what's happening around us, and we discussed this and said, hey, here's a real problem. And around the same time, I had my first child, my daughter, and in the first 12 to 18 months, we had to take her for vaccination. And the same issue used to kind of recur there in a very different context, that we'd end up taking our daughter for vaccination. And vaccination chart bhul jate the. And as you would know, and as a lot of your viewers who are young parents or would remember their young parenthood days will remember, that it's a stress to take a child for vaccination. She's cranky, she's hungry, you are yourself stressed. So forgetting a vaccination chart, I've been told, is a very common phenomenon. And ask any pediatrician, they are not happy. Ours certainly wasn't, because now he's going in blind, kya vaccination kya dena hai. So, these were a couple of small instances. In isolation, they sound very peculiar or very typical and minor, but that pointed to the fact, a very deep fact, that as a country, we've seen digitization like nothing else. You see, go back 15, 20 years, you had to make so many visits to the bank. I remember going to the bank to get demand drafts made, or you remember, your share transfer, those green colored share transfer deeds that had to be filled in, you to go carry them to the registrar. All of that is now on your mobile phone. But all said and done, in spite of all the digitization that we have seen, healthcare has been left behind. And that was the genesis of Briefcase. That we said, here's a need to digitize healthcare. And let's not take a transactional approach. Let's not try to sell medicines cheap. Let's not try to sell lab tests cheap. There are people who are trying to do that. Let's be a trusted platform for the patient where she can manage her health information and be a partner of our health journey from there.
So what are the kind of offerings that you started offering on a Driefcase, and what needs of the user did you have in mind developing this app? Because you had those two peculiar incidents, but the business cannot be based on these two small elements.
Absolutely. Absolutely. So our core offering, Harbinder, as we started, was what is called a personal health locker. It's like a locker. It's a place where you can, in a secured environment, store all your health information, all your health records. Um, Over our journey, we would have spoken to hundreds of thousands of users, and universally, this concept is loved, well loved. I talk to you and I tell you, Harbinder, what if I can get all your family's medical records on a phone? You say, "Yeah, it's a no-brainer. Let's do that." Having said that, no one does it. And that is what we realized was the real challenge. That while there was a need for this, there was this big issue of, call it, user inertia. I want my locker to be updated with all my health information, but please don't ask me to put in the effort. So our core offering was targeted at resolving this pain point, that give people a secured environment to host, to store all their health information, yet not have to put in the effort to kind of keep loading. As you said rightly, that this was just the start of our journey. We said personal health locker will be a start of our journey. In that journey, we spoke to hundreds of doctors, thousands of doctors. The idea was to go to them, because digitization of healthcare is not possible only if you target one stakeholder, which is the patient. You have to target all the stakeholders. So in that journey, we went to doctors, we showed them this product. Again, they loved it from a patient's perspective. And they said, why don't you build something for me also? You have it in your DNA to make things simple, make life simple for me as well. So we added Briefcase Connect as a solution for doctors to digitize their practice. And because Driefcase and Driefcase Connect kind of get connected at the back end, it also makes communication between the doctor and the patient seamless. So that was, for the first 3-4 years of our journey, those were the kind of two offerings, two stakeholders that we were taking along in this journey of digitization.
So what did you do differently that solved this problem?
Sure. So a personal health locker, Harbinder, again, is not a new product. Um, I would say that every meaningful app, healthcare app in the past, has had a locker as a feature. So if you pick up any diagnostic chain, any of the big diagnostic chains apps, they would say, "Hey, you can store your health information here." Or you look at any of your, large health tech apps of the past, everyone would say you have a repository. The real challenge, as I said, is repository to hai, but who will load records into it? And all these expected the user to load records into it, to tag information. Now, let's say if you have 50 records at home, and I told you click 50 pictures for all these 50 records, mention the date of the document, what's the type of document, what's some tag for this document, so that it becomes easy for you to retrieve. Because mind you, storage is one part, and that sometimes is easy. You can say, I'm in a Google Drive, I've scanned and put everything. Retrieval is equally, or sometimes I'd say more important. Can you find that document in a matter of seconds? And that is where we were different, or what we've tried to create is different. We tell users, with minimal effort, you can load records into the app. And when you have to search for any document, our promise to our users is it won't take you more than 10 seconds. How do we achieve that? So uploading, as I said, there are multiple ways of uploading records. Simplest is you can actually WhatsApp your document to a centralized number. So Harbinder WhatsApp a record to our centralized number, it goes in his account automatically. Or you can email, or you can click a picture and upload. And the way the email works is it's kind of your unique identifier. So harbinder.narula@driefcase.com. It's not necessary you email it. The lab, the hospital you go to, you give this as your registered email address to them. So the moment a report is generated, they send it out on email. Instead of going to your registered email, it comes to this Driefcase ID, goes in your account and gets forwarded to your email address. So एक bypass mechanism बन जाता है, which ensures that your account is updated as well as you get the report on your registered email ID as well. That's the start. Every document that comes into Driefcase is then tagged for certain elements. What's the name of patient, doctor, hospital, type of document, and date. That ensures the retrievability that I'm talking about. Any document you want to find, my account, for example, across my family members, and it's a family account construct. So in the same account, you can have your family members. In my account, I have 1,500 records. But as I said, any record I want to find, it takes me less than 10 seconds. All I need to know is some element of that document that I'm talking about. Let's say my mother's blood sugar report, broadly speaking, of 2022 February. I put those two, three parameters, and I'll be able to zero in a document in less than 10 seconds. So that's where the unique element has come in to make it easy to upload and retrieve records. Of course, the Ayushman Bharat Digital Mission, and I'm sure we're going to talk a lot about it, changes the game or takes the game to another level for us, because this takes away all your manual intervention from the patient completely. You don't even need to upload records; they get uploaded automatically. So I'm sure, as I said, I'm sure we'll talk a lot more about it, and I'll cover it in that section.
So Sohit, I have a question that, I upload my records or the records get uploaded in my account, which is coming from a hospital or a lab or a doctor, wherever it is coming from. And I retrieve my account or I retrieve my, what do you call the records that are there or the reports. But what happens in case of an emergency when I am taken to a hospital and I'm not in a position to retrieve the record? Does the healthcare institution or a doctor have access to your records?
So there are two aspects to this, Harbinder. One is it's the aspect of this emergency care, which is where the construct of family account also becomes more relevant. So if you look around, in every family, there is that one member of the family who's the core primary health caregiver, you can call it so. It could be, for example, in your family, it could be you or your spouse. Uh, so in my case, for example, it is me. I know the health issues not only of my parents, but of my child, of my spouse, and I know where the health information is. But yes, what happens in case I am the one who's subjected to emergency? And which is where this whole family account construct, that any of your family members can retrieve the health information and share it with the care provider. So that's one aspect of it right now. With the Ayushman Bharat Digital Mission, there are use cases being built, so call it break the glass kind of use case, where there could be certain elements of your emergency health information that you can designate to be shared with a care provider in case of an emergency, even when you are not capable of giving that. So yes, those use cases are also being built to automate that process. In the absence of that, your family members kind of step in and play that role of sharing the health
And how do you ensure the privacy of this? So while the whole core is that the data should be available or these records should be available to you at any time that you need it, it should be available to your doctor in case of emergency. But how do you ensure the data does not leak out? And because health records are typically very, very highly protected for privacy laws. And also, would this data be available or accessible at any point in time to your insurance company?
No, great question. It's a question that comes up a lot to us from users. So let me start talking about first the aspect of privacy from a regulatory perspective. The good thing is that over the last 5, 6, 7 years, data privacy norms in this country are becoming kind of clearer and clearer. Today, it is um, quite clear that the healthcare information ownership rests with the patient. And the reason I stress on that is because it's a question that has floated around for far too long as to who owns the data. Today, regulatorily, that ownership question is in our minds completely settled. It belongs to you as a patient. How do we follow that? Is that no specific data, healthcare data, can be shared without your action. And I call it action. I don't call it consent, because historically consent has had a tendency to be considered as a tick mark on the form. Now, thanks to the Ayushman Bharat Digital Mission, thanks to the data privacy laws, consent does not mean a blind tick on the form. Consent means a specific consent in a specific format. For Driefcase, over the last 5, 6 years, even in the pre-ABDM era, the way we did that is we used to call it positive action by the customer. So you can go decide to share your records with your doctor, with your insurance company, with your friends, whatever you want to do. Briefcase will not share that. So that's one way of ensuring privacy. Now, in the new regime of the digital mission, the health stack, this comes in the form of a consent artifact, which is something similar to how UPI works. That you can move money from your X account to my Y bank account by going to a third party app, UPI app, and specifically putting in a consent pin. So that's the same mechanism that is coming in now. So that's the privacy aspect of it. As an organization, how do you ensure that, as you said, one is your intentions are right, but also how do you ensure it in practice? So we've taken a lot of steps on the security aspect of data. So your transmission of data is encrypted. Your storage of data is encrypted with a second layer of encryption. So we've followed the best practices that are followed around the world as far as data security is concerned. And the analogy we give to our customers, to our users, is think of it the same way that you think of a net banking transaction. It's a kind of similar level of security that we are treating this data with, as gets done in the case of a net banking transaction.
See, the issue that has always been there, so it has been, and something that you're trying to solve is the interoperability problem, right? So hospital had their records, because they've always had their records. Every diagnostic chain has always had their records, but they were not interoperable with each other. And now the data rests with Driefcase. Is that correct?
That's correct.
Now, I'm sure there are other companies also entering into this space. And also, like in the case you mentioned, which triggered off this thought process where Harsh's uncle or the relative, the old uncle, he was from the US. So are you planning on creating interoperability with the, say, similar players in the international market or other players in India?
So, Harbinder, when we started Driefcase, the idea was that we would create an interoperable ecosystem ourselves. And that's what we had started doing. But along the way came the health stack, the Ayushman Bharat Digital Mission. So now, actually speaking, we don't need to create that interoperability. The government through this mission is creating the interoperability. So what's happening is, if you look at US digitized their healthcare 10 years back, 10, 12 years back, thanks to Obamacare. And today their system is beautifully digitized. I use the word beautifully digitized, but it missed on this point of interoperability. So today the US system works in silos, as I said, beautifully digitized, but in silos. So if you are within that silos, you're fine. If you are within the network of your insurance company, you're fine. But God save you if you're trying to move from one silo to the other, because then that's where the nightmare. Thanks to us now starting at a time where we have seen success of interoperability through UPI, we've seen success of digital identity through Aadhaar, we've been able to actually leapfrog that. So today, the way the health stack is playing out, the focus is more, if you ask me, on interoperability than only digitization. So as a participant in the Ayushman Bharat Digital and as an early participant, we are seeing it play out in actually a fabulous manner, I'd say. So the way the framework is designed, you can go to any hospital, you can go to any lab, you can go to any doctor. If that healthcare provider is a participant in the mission, has plugged in or integrated into the Ayushman Bharat Digital Mission, then your data is available for you to fetch anytime, 24 by 7, and share basis your consent. So there it works in a very seamless manner, in an interoperable manner. The layer that Driefcase brings in is, or the functionality that Driefcase brings to you there is twofold. One is we are like, if I can use a term of Google Pay or Phone Pay of the healthcare. So you can use Driefcase to create your health ID, the unique identifier. You can use this platform to give consent to movement of health information. So let's say you've gone to a lab, your report is got generated, and then you go to a hospital for consultation and they want to see your report. You can approve that movement of health information through the Driefcase platform. And the core product that we spoke about, the Health Locker, ensures that you maintain a copy of all your health information, a verified copy of all your health information on the Driefcase platform. So, which also means that if, let's say, some of your providers are not yet onto the framework, because let's say a family physician is not there on the framework because it'll take time to kind of propagate, you can actually upload that record or that prescription and link it to your health ID so that it becomes discoverable for your other care providers. So you can play that role of the bridge in the meantime till ABDM becomes mainstream and every provider out there in the country is plugged into. You also asked a question about international interoperability. Um, so there, again, we take UPI as an example, that UPI started as an India-only framework, and now you see how interoperability is coming in internationally. We have tie-ups with Singapore. We recently announced tie-ups with some other country. We believe that if the Ayushman Bharat Digital Mission plays out the way we foresee it playing out, it will be a role model for the world to follow. The way the COVID model, for example, was exported to the world, that we created a framework in India and multiple countries around the world are now replicating that, and we are helping them replicate that. We believe this is something similar we'll see here. And once that happens, interoperability internationally would become feasible and mainstream.
We've been talking a lot about, I mean, you mentioned Ayushman Bharat Digital Mission a couple of times. Can you explain for the benefit of our viewers what is ABDM and how does it make a difference to our lives?
Sure, sure. So, the reason we talk about ABDM so much, I'll just give probably a 10-second headline message before I dig deeper into it, is we believe that the Ayushman Bharat Digital Mission will change the face of healthcare in India. It will change the way we traverse our health journey from now. So, what is this Ayushman Bharat Digital Mission? It's a digital framework that is being created by the government of India to enable interoperable and seamless digital healthcare in India. What does that mean? For people like you and me, today when we go to a doctor, we are carrying all our health records, all our health information in a bag. We store these records at home in a drawer. Um, the idea behind the digital mission is to make sure that how your, as I mentioned very earlier, how your banking has become digital, that you don't need to carry paper around. Similarly, in healthcare journeys, you don't need to carry paper around. So you go to a doctor, your past reports are available to the doctor or accessible to the doctor basis your consent in a digital format. The doctor issues a prescription to you in a digital format. If you get hospitalized, then your entire health information is in a digital format. Your insurance claim processing is paperless and in a digital format and seamless. So think of it by saying this way, that you go to a doctor with nothing but your phone in your pocket. You come back with nothing but phone in your pocket. You get admitted with nothing, no requirement of anything else. And in the background, the entire insurance claim processing is happening, in a paperless mode. So that's the kind of impact we see. How checks and demand drafts are relics of the past. We believe your healthcare records will be relics of the past. So one part is from your healthcare journey perspective, how will it impact your healthcare journey, make it easier? But also think about the possibilities that once your health information is available digitally, the possibilities that it opens up for you as a patient. Today, if I told you, Harbinder, do you track your sugar levels? You'll say, yeah, Sohit, I do it, over the last 3 months, my sugar levels have broadly been around, my HbA1c has broadly been about 6.5 or 6 or something like that. Tomorrow, you'll be actually able to see it not only for the past 3 months, which you maintained in an Excel sheet, but across your lifetime. That, when I was 20-year-old, there was a test done, and by the way, my HbA1c was then also 6. So it's not that even at the age of 40, 45, 50, my sugar levels have shot up. This has been the journey that, for example, I'm just taking one example of sugar levels, but you can now extrapolate it to your entire health history. That once it is available in a digital format, it will make tracking for you easier, and most importantly, it will make diagnosis for your doctors far more robust and far easier. They are not going in blind. You go to a consultation. The first consultation, Harvinder, you'll remember always with any doctor, the first 10-15 minutes are in and telling them what's your health history. Yes, sir, I have had hypertension for last, I think, 8 years, and your spouse is saying, no, Baba, it's not 8 years, it's been 12 years. Or I had this surgery way back in sometime in 2000, and the doctor is now thinking, how much of this data do I trust? To saying that, here's my health history on digitally in a concise format that tells the doctor what's my background in medical terms.
So this is very interesting, Sohit, what you're talking of. What are your next big plans in terms of, features, etc., that will make Driefcase a bundle of efficient data sharing? Because, for example, one is putting the data records and storing them, right? But that data is over a period of time, like you said, you already have 1,500 documents in your database in your account, right? But over a lifetime, this could be like a bundle of records which are like relevant versus something which is not relevant anymore. But is there some kind of a dashboard that is available so that it tracks and makes that information more meaningful to you?
Sure. So, in terms of our features, that's exactly the feature that we are working on. That there are multiple sources of data, healthcare data, that are flowing into Briefcase. People upload them on their own through WhatsApp, clicking a picture, through email. Your providers send the data to healthcare records to us. The records will come through ABDM. So we are working on putting together this dashboard, which will not only give you, a place to track certain parameters, which is, if you ask me, the easier bit to say, sugar levels across the last 5 years, 10 years is mathematical data representation, but a dashboard which is far more comprehensive to include not only this level of information, but also your allergies, your past surgeries, your medications. So, as I said, in a very easy to understand manner, a dashboard that can explain your health history to your provider in less than a minute. And to you, not only to your provider, but also to you. So that, as you said, this 1,500 documents concised into probably one A4 sheet. That's what is one of the big projects or features we are working on. Right now, of course, the focus has been a lot on integrating into ABDM, getting more and more providers linked in, because that's how the flow of information starts. So that's been the focus over the last year or so for a lot of us in this ecosystem. But as that starts getting stable and settled, this becomes the next area of focus for us.
So which has been the more the painful part, getting people to sign up and get them on board, or the healthcare providers to join in?
And neither is easy. No, it's been an interesting journey, Harbinder. That as I said, the interesting part is both sides want it. So patients or users, when we talk to them, they all love the idea. Their challenges are different. Their challenges are more on the inertia side, and I won't. While we keep mentioning this a lot of times, honestly, we completely identify that, right? We are also a user. And how many times do we? It's not a core task for us, and it's not expected of us to keep clicking pictures and upload. So that's been their challenge. If you go to the provider side, it's again something that they need. We have some of the most high-profile doctors on our platform who are seeing, literally, who can in a day see hundreds of patients in OPD and IPD rounds, and they want it because it makes life easy for them. However, if as a doctor you've been practicing for 10, 20, 30 years, it's very natural for you to have developed your own working style. Unfortunately, most of us in the past, or most of the systems in the past, have focused on changing their work style. And then we go around saying, user behavior change takes time. But the fact of the matter remains, if you give them a solution which can adapt to their working style, then they will be strong proponents. And we've, as I said, we've had instances where, my favorite story is about a doctor who said, I want to get started, and we went to meet her in her kind of setup, and her husband, who's also a doctor, was around, and he said, "Best of luck, guys. You're the fifth guys in the room discussing the same thing. Let's see if you last beyond 3 months." And we are right now in the third year running with the doctor, and it was we were always told that doctors are very kind of hesitant to adopt technology. As I said, what we realized is, like any of us, if I told you, Harbinder, that, in your work, daily work, here's a new tool, but you'll have to change the way you do. So you cannot write with an ink pen anymore. You have to just keep typing, and you have to type specific words at specific areas. I'm sure you would say this doesn't work. So that's been an interesting journey and a learning for us on both sides. Having said that, neither is very easy, neither is impossible, but neither is easy. So we learn every day.
No, I think you're absolutely right, because what happens is that what I've seen in the healthcare industry is very difficult to disrupt something which has already been happening, because it just changes the way of working, and which everybody is very close to. But if you can build efficiencies to what they're already doing, I think it's the adaptability kind of takes off. uh, while you're working on solving one particular issue, India needs to digitize healthcare far beyond just the personal health records. In your opinion, what are the other areas that you feel need attention right now, and not much is being done in that space?
So, you're absolutely right that, it's um, healthcare digitization is far beyond what we are talking about right now in terms of, personal health records. Uh, the way we see it is, the health records form the core of the journey. And that is where we see it as a great start. That because this then drives your insurance, this drives your IPD, the hospitalization, and all. Few more areas where work needs to be done, and which has already started happening, is, A is on access to healthcare delivery. Um, there is, you'll hear divergent views on whether we have sufficient medical infrastructure in this country. And by medical infrastructure, I mean the soft infrastructure. Do we have sufficient number of doctors? Yes or no, right? WHO prescribes a certain number, and you'll read different reports, some claiming we have enough, some claiming we don't have enough. If you look around you, Harvinder, there will be doctors who don't have time to breathe, literally don't have time to breathe. And yet there are doctors who have a lot of time at their hand. In our view, the issue is not that we don't have sufficient doctors. Yes, more doctors will always be good, and that's where, for example, the government is working on improving that as well. But the issue is, where are those doctors located? If all your good doctors, all your specialists and super specialists want to be in Mumbai, Delhi, Bangalore, Hyderabad, Calcutta, Chennai of this world, how will people in tier 2, tier 3 cities get access to that? And which is where probably technology can play a role in bridging that gap. One thing is to tell doctors that you have to go and spend some time in rural areas, but we know it works in some cases, it doesn't work in some other cases. Technology can help improve the access. So that's one place where a lot more work needs to be done. Thanks to COVID now, for example, teleconsultation has become more accepted. And government has been doing a lot of work on the e-Sanjeevani program. There are lakhs of consultations that get done through that. But I think more work needs to be done there. And then if you extrapolate this further, access also to, for example, emergency beds, or information about where the emergency beds are available, how many are available, access to that, ambulance services, a lot of these things where we've seen technology play a role and bridge the gap in other sectors. we believe the same thing needs to be done on the healthcare side. And we can't leave it only to the government to solve this problem. It can't be solved only by the government. It needs to be a public-private partnership kind of model. I'm not talking in the typical infra context of a PPP model, but a broader framework of a PPP model where you say that, here's a digital public good I have created, and let private innovators innovate on top of it. But access to that extent, according to us, is something that is needed. Uh, Also, it will help improve the affordability aspect of it. And access plus affordability, the way we see it, leads to universal health coverage, which is the holy grail for all countries. So I think that's where more work needs to be done. There is a lot of thought in the ecosystem on that, and we are super hopeful and excited that some of this would lead to a country which has far better healthcare infrastructure for our future generations than what our past generations have seen.
So, is Driefcase a funded organization, and what are your plans for raising more capital?
So, we've been bootstrapped for a large part of our journey. The idea is to keep to raise some money, because what we're trying to achieve would require capital. Healthcare takes time to play out. And so fundraising for us is, as I keep saying, an ongoing conversation. It'll help to have money, but it's not the kind of core objective for us. So we keep talking to a lot of people on various aspects of it, and yet keep our heads down, just keep focusing on the business, because at least being past investment bankers, we do believe if you build a good business, then everything else becomes a solid byproduct of it.
So, Sohit, my closing question to you is, you've been an investment banker, you've been in the corporate side of life, and then you became an entrepreneur. And like you said, for a large part of your initial entrepreneurship was running a bootstrapped organization. How has it been personally for you? And what is the tip that you would like to share with anybody else who's wanting to move from the corporate side to being an entrepreneur?
So it's been an interesting journey. I had a great run as an investment banker. But what I mean by great run is I had a great time. I used to enjoy myself. 11 years spent with smartest people, great bosses, great clients. So that way I had a great run there. Entrepreneurship has been, again, I use no other word but a great journey. It's been very, very different. I keep joking with a lot of my corporate friends that, do you guys know who's, and I'll ask this question to you also, Harbinder, do you know who's the internet service provider for BW, the office where you're sitting? Do you know who's the internet service provider? And, the answer most often than not is no, we don't know. And I'm like, it's not only that I know who's the internet service provider for our office in Driefcase, I know what plans we have taken and what plans we can take if we have more money, or what plans we'll take if we have less money. So it's been a very, very interesting journey. My message to people is it's very difficult for anyone to convey, the journey that they are going through, and you will go through your ups and downs. I think one thing that I keep telling people is I have seen the range of emotions I did not know exist within me. I have seen those over the last 5-6 years, from a time in investment banking where I was considered to be one of the calm people, to being just an all-out shouting kind of person in the first couple of years at Briefcase, because things just didn't seem to be working the way we wanted them to work, or people weren't responding the way we wanted to respond, to being ecstatic, to being completely low. So it's a range of emotions that you go through. It's a great journey that everyone should try out, but of course, which is not to say that the corporate world is not a great journey. Sometimes I read this somewhere, Harbinder, that the value of a well-paying job which you enjoy is so underreported or is so underestimated in the current world, given the glamour of entrepreneurship. But it's an interesting journey, no doubt. Shows you a different aspect of life. So I'm very thrilled, and I speak on behalf of Harsh and myself that we are very thrilled to have seen both sides of the journey. Won't trade one for the other. And messages, if you can try both, certainly try both and then take your pick.
And I totally agree with you and resonate with you because I've been there on both sides. And I know that, entrepreneurship cannot be explained. It can only be experienced, I'm so glad that I was able to speak with you. Sohit, thank you so much for joining us. It's been such a pleasure. And I wish you, Harsh and Driefcase the best of journey in the coming times.
Thank you so
Thank
much.
you so much for your time.
Thanks a lot.